Okay, glad to have everyone here with us today. Greetings to everyone from around the world. I hope everyone is having a good day so far. So, today I'm here to talk about this new audiological test, which was developed by Demand and hopefully provides a new standard of care, not only for a year or two, but forever, if possible. And that test is called Audible Contrast Threshold, or ACT in short. And as most of you probably already know, I'm Marielle. I'm the international trainer for Burnaphone, and I'm very excited to be here today to talk about this new test and how it can make a huge difference in your practice. So this webinar will be recorded. We will be sending you the links to the recording to all of the attendees. Even if you can't make it today, you can view it at a later time once you're back. In the future, again, don't worry, just register and you'll receive all the link and the handouts. So the agenda for today, it will be all about ACT. We'll first talk about what exactly is ACT, the benefits for you as a HCP, how do you do ACT, and what does it look like inside Oasis next. I'm also going to be giving you 2 case studies. So of course, we will talk about, most importantly, the practical aspects that you need to know regarding ACT. And throughout this presentations, I'm very sure some things might not be clear. So again, you can just type the questions in the chat box and I will answer all of these questions at the end of the presentation. And don't forget, we also have a very short and fun quiz. I promise you it's very fun. Okay, I cannot promise that because, quizzes, but you can easily finish it in 3 to 5 minutes. And the presentation will take around 45 to 50 minutes overall, depends on the questions that we get. And after that, I promise you freedom. So let's move on and talk about ACT, which provides a new way to measure a person's speech and noise ability. All right, so anyone knows what this is? I believe and I hope 99.9% of you knows. So basically, it's an audiogram, and this is basically a graph that shows you how well a person can hear. The 2 lines you see there, the red and the blue, the higher they are, ideally in the purple color, that means that their hearing is really normal and really good. So the audiogram tells you which sounds are audible, including speech sounds, but also daily life sounds from the environment. And basically, after you do the pure tone audiometry, or what we call PTA, it's another word for a hearing test. And with this, we are able to know one's hearing level and how good or how bad it is. Did you know that this audiometry test is actually more than 100 years old? And that is for a good reason. That's because it's the most basic but most important test that we actually do in audiology. And of course, audiometry is very important. But what information is still missing? What do we not get from just doing an audiometry test? The audiogram obviously does not tell us how a client will actually perform in the real world. Because in the real world, we do not use pure tones or warble tones to talk and communicate. And we are not stuck in a soundproof room the whole day. Of course, if I do this presentation in pure tones, that will not work also. And many studies throughout the years have shown that getting a good hearing test result does not automatically mean you can hear clearly in noise. So that is one big factor. Recent consumer studies by Manchiaya and others in 2021 have also shown that 86% of hearing aid wearers actually have difficulty understanding conversations in noisy environments. So this problem remains to be the biggest challenge for hearing care professionals and clients alike because pure tone audiometry is able to diagnose a person's hearing loss, but it cannot diagnose the ability to hear speech in noise. Now, let's talk about speech audiometry. And when I say speech audiometry, it's a general term that I like to use to describe this collection of different kinds of speech tests that uses speech as the stimulus instead of a tone. So you can perform speech audiometry by presenting speech in quiet. That includes tests such as SDT or speech detection threshold, speech reception threshold, and word recognition score. So we do the speech test in quiet. And you can also, of course, do speech audiometry in the presence of noise. For example, hearing in noise test or hint, and quick speech and noise test or quick-syn, etc. So what information do we get from doing speech audiometry? First, you can perform speech audiometry and it will be able to give us very useful information on how well your client can hear and access speech information and not just tones. It helps us know if our client with hearing loss can still recognize or discriminate speech before fitting them with amplification. So in the case of severe to profound hearing loss, you do a speech test. Speech course is 5%, 10%, 12% out of 100. Obviously, that suggests fitting it with amplification will not be sufficient and would probably be candidates for cochlear implants. Second, it allows us to cross-check or compare with the pure tone audiometry test results. So if the PTA shows a mild hearing loss, but the speech audiometry test shows very, very poor speech understanding, it doesn't make sense because normally if you have a mild hearing loss, you should be able to get up to 100%. So that means that the client might also be giving fake responses. Third, speech audiometry allows us to detect if our client might have other issues, like cochlear dead regions, where there is a permanent loss of inner hair cell function, and thus they cannot hear or benefit from amplification. And it can also detect retrocochlear issues, such as if there's a tumor along the auditory pathway, for example, close to the brainstem. And these cases will suggest that you refer this client for further assessment. And finally, doing speech audiometry helps you predict how successful the hearing aid amplification for your client will be and how well they will be able to hear with the new hearing aids. So based on how good or how bad the speech results are, you can then use all of this information to set very realistic expectations during counseling. And that really helps if you want a very happy customer. So now we've talked about all the benefits that you can get with speech audiometry, but what are the limitations? Time. Time is a big one because depending on the test that you do, you can easily use up to 10 to 20 to 30 minutes just for doing speech tests. And that is a very long time for a session with the client. Language, of course, it's another issue, including the availability of validated speech materials, which some clinics might have and some not. And for a lot of these things, you have to buy them. So there's also the cost factor involved. There is also a high level of training and technique required for the HTP to do these speech tests with confidence. And it's not as simple as doing a pure tone audiometry test. And it's also more expensive because it requires an elaborate setup. You need a proper room, a proper acoustic, And also the location of the speakers need to be in the proper place. So it's much more complicated than just doing PTA. And of course, most importantly, it is actually hard to use the results that you get from the speech test to adjust the hearing aids. So in that sense, it's also very limited in terms of benefit. And no wonder, of course, speech tests are considered in most clinics, I would say an optional test because for a lot of these clinics, there are too many challenges in making it part of the protocol. When I was still practicing, it was actually something that I did more thoroughly when I actually needed to, when it's a difficult patient or that patient had a ski slope loss or a very special configuration of hearing loss, but I did not do this test for all of my clients because it just took too much time. And I did a survey when you guys registered. You also helped me answer this question. And here are your answers. So you can see that 26% of hearing care professionals do speech in quiet tests only. That includes SRT, word recognition scores, etc. So that's nice. For those who only did speech in noise tests, like HINT, it was 10%. And for HCPs who did both tests in quiet and in noise, it was 21%. So I'm very, very happy to see this because it's obviously more than half. But equally glaring is the fact that 43% actually don't do any speech tests. And I can understand that. So there definitely is space for improvement in terms of doing speech audiometry, especially in noise. So we know that the audiogram is vital to program the hearing aid, but it's still incomplete and does not give us all the information. We know that speech testing is a great addition, but it also has a lot of limitations. So what can give us an accurate diagnostic information beyond the audiogram that can address the number one complaint, which is hearing in noise? And that is why I would like to present to you a test designed to make speech and noise testing better and easier than ever before, and that's ACT. So why ACT and why now? Today, hearing aids are fitted based on audiometric thresholds from 250 hertz to 8,000 hertz. But hearing loss is actually so much more than the simple inability to hear soft sounds. And researchers in the hearing aid industry have long looked for solutions and tests that try to go beyond the audiogram to add to the whole fitting flow. But of course, mostly were not successful because the tests that they were trying to develop just lacked the relevance and usefulness because they could not really predict the important aspects that we wanted to measure, like one's ability to hear speech and noise. And that is why, together with the audiogram, which measures the quantity or the hearing ability, ACT measures the quality of hearing in a real world situations with lots of sounds all around. And with both combined, you get a complete diagnosis of your client's hearing. So in this sense, the audiogram is a foundation for prescribing the appropriate amount of amplification, whereas ACT can serve as a foundation for prescribing the appropriate amount of support in noise. And this test, of course, it's possible thanks to all the research that was done by the different groups in DMAND. The Interacoustic Research Unit did up to 7 years of research on ACT. Then we invested more years translating this research into clinical viable and useful tests with partnership from Interacoustics, from Ericsson, and also from CAR, which is the Center for Applied Audiology Research in DMAND. So together, all of these different groups have developed ACT into a simple but very powerful test that you can do in as little as 2 minutes. Let's look a little deeper and explore what ACT is. So, ACT is an above threshold, non-language specific test that measures the client's real-world speech and noise ability. Above threshold meaning that the test takes the hearing loss into account to ensure that the correct stimulus level is applied, and non-language specific, meaning it can be performed on anyone, regardless of their language background or ability. So after doing the ACT test, it will give us a number, an ACT value, which will be automatically be imported to Oasis Next from NOAA. And then the ACT value can then be used to prescribe just the right amount of help in noise in Oasis Next. How to perform ACT. So the ACT test is like doing a pure tone audiometry test, but with some background noise added. So it was designed to have a very similar procedure to PDA, obviously. And now I will show you a video where you will see the whole process from start to finish.
The Audible Contrast Threshold Test, also known as ACT, allows you to assess how well someone can hear in background noise. It does this by using a special signal that is non-language specific. ACT makes full use of the pure tone audiogram, making this an above threshold test. To perform ACT, you will need an audiometer with the ACT license, headphones or insert earphones, a patient response button, and a completed binaural audiogram with thresholds stored for at least the following frequencies: 250 Hz, 500 Hz, 1 kHz, 2 kHz, and 4 kHz. Now we have everything we need. We can go ahead and perform ACT. From the audiogram screen within the Affinity Suite, go to Menu, select Tests, and then click on ACT. An instruction box will automatically appear. Instruct your client on what they need to do and make sure they understand to press every time they hear the special signal, which sounds like a siren. Ensure that you have demonstrated the sound examples so that your client knows what to listen for. Once your client is ready, click Proceed to Test and press Start. As soon as you press Start, your client will hear episodes of noise. The test starts at 16 dB NCL. Press only once to deliver the siren at this intensity. If the client hears the siren correctly, a black dot will automatically appear on the trace. You continue performing the test in the same manner as pure tone audiometry. Once a heard response has been stored, go down in intensity by 2 steps and present again. If the client does not hear the siren or does not respond to the sound in the correct time frame, a white dot will appear and you increase in intensity by 1 step. This 2 down, 1 up approach is the same as audiometry, and the test will automatically stop and store a value once it has reached 3 out of 5 correct responses. Once the relevant number of correct responses has been reached to produce an ACT value, a green bar will appear in the middle of the screen. You can now use this to counsel your clients about their ability to hear in noise. Press on the Guidance tab to reveal our recommendations for the different ACT severity levels. Use this for counseling, to adjust hearing aids, to recommend assistive devices, and to discuss rehabilitation and communication strategies. Selected hearing aid brands use the ACT value to automatically optimize their adaptive hearing aid features.
Okay, and I'm very happy to tell you that one of those selected hearing aid brands is Burnaphone. So, hurrah! All right, so here's a quick summary of how the ACT test is performed. During the test, pink noise is presented binaurally via headphones as a constant background noise, and the sound level of this pink noise is based on the hearing loss. A spectrotemporal modulated signal, or STM for short, which has very similar characteristics to a speech signal, is presented. And this STM signal, basically, it sounds like this ambulance or emergency siren. So the client's task for the ACT test is basically to recognize when he hears the siren, and as soon as the client hears this signal, he presses the response button. So after doing the procedure, the final test or the final result is the ACT score between -4 and 16. And the higher the value, the more difficult it is to hear speech and noise for the client. Again, I repeat, the higher the value, the worse the score is. So if you actually get 0 in this test, that means you have very good speech and noise ability. This is the one time that 0 is a good thing. Now let's take a look inside ACT in Oasis next. So as you saw in the video earlier, remember that the ACT test is done with the Affinity Compact Diagnostic Equipment. It is also available in other companies, but that I'll discuss later on, okay? So step 1, you do an audiogram, then you select ACT, and you will see this instruction box open up. And there's a script that will tell you what to say to the client. So for example, I'm the HCP. So now I will tell the client, now we will do a test, which will be able to determine how well you can actually hear in noisy situations. The result of this test can then be used to adjust the hearing aids to give you the best performance in noise possible. And then after that, you will see buttons on the right, and you can familiarize your client on what to listen out for with the sound samples. And then finally, you can click on this button that says Proceed to Test to begin. So once the required number of thresholds have been reached, so 3 out of 5, that was what the video has mentioned, the test automatically stops, and this bar, this green bar above the graph will turn green, and it will show the final calculated ACT value. In this case, it's 2.5 dB NCL. So the ACT result is actually measured in dB NCL. When we do the hearing test, it's measured in dB HL. And basically, that's the form of measurement that we use for ACT, which stands for normalized contrast level. So that's quite a mouthful, but that describes the whole test. And in this example, remember, it's 2.5 dB. And then there's one more thing I want you to pay attention to. If you click on guidance, you will see this ACT guide showing the different values and what they mean. So the ACT values are divided into 4 different categories in terms of severity, and it's very similar to pure tone audiometry because you have normal, mild, moderate, severe, not profound. Normal is when you get an ACT score of -4 to 4. Mild is 4 to 7, moderate is 7 to 10, and severe is 10 to 16. So in other words, the higher the ACT score, the more help the client needs to hear in noise. And earlier, our score was 2.5 dB NCL. So this falls into the first category, which means the normal ability to hear speech and noise. Sometimes you get a negative score, minus score, but that's really very rare. And it's for someone who can really detect and hear speech very well in noise. So in this case, if your client scores in this category, They can most likely discriminate and recognize speech and noise and perform well in a noisy setting. There's also a fitting advice section here. I don't know if you see it. And it says here that the adaptive features should actually be set according to, let's really small. Okay. Adaptive features should be set to the minimum level and that you should help preserve the natural sound in all environments. So that's a priority for those clients who are under this category. On the other hand, if you look at the other end, which is the severe category, let's say if your client score is 10 dB NCL, it falls under this category and it suggests severely poor speech and noise performance. So here, the fitting advice says that adaptive features should be set to the maximum level to help prioritize speech understanding, and that the client should also consider streaming devices and communication training. So this is probably the point where you should really consider devices such as Sound Clip A to help the client hear in longer distances or situations with so much noise and reverberation. So in Oasis Next, you will find ACT under the Client tab right here. The 2.5 dB NCL ACT value we had from Affinity Compact will be stored in NOAA and automatically transferred here. And you can see that 2.5 dB NCL is still within the normal range, suggesting that the client has normal speech and noise ability. And of course, the darker it is on this range, the worse the speech and noise ability is. Then, after we have the score, you will see under the Features tab, this ACT value will then automatically adjust the level of noise management support to optimize speech understanding in noise. You'll see this later on in the case study. So the ACT value will influence the prescription of the following features: smart directionality states, smart noise reduction, transition, speech balancer, noise balancer, and transient noise reduction. So one thing which is very important for you to know is that the audiogram and also the age of the client, in addition to the ACT value. So these three things, audiogram, age, and ACT value, will actually influence these settings. So that means that even if the ACT score is exactly the same for two different people, if the audiogram or the age are different, then it will not give the exact same changes in these settings. Now, let's talk about how ACT can potentially benefit you in your clinical practice. Better hearing aid fitting as well as counseling. So, if you give a more personalized level of noise adjustment right at the start during the first fitting sessions, there will be less follow-ups and more client satisfaction because there are fewer overall complaints on speech in noise. And ACT can also be the basis for choosing the right technology level. So let's say that the ACT score is 16, and that is the highest and most severe score. But your client wants the cheapest, most basic hearing aid possible. He said, just give me the cheapest one you have, it will do the job. So by showing them actual proof that their speech and noise ability is really bad, you can actually upsell and recommend a higher technology level that has a better noise management options, which leads to an overall better average selling price or ASP. And of course, you can close the sale and sell that hearing aid. So higher conversion rate. And you have a number, you have something to show the client, so you're not making it up. And of course, ACT goes beyond the audiogram by quantifying not the hearing level, but the client's ability to hear in noise. And that is a very unique selling point because anyone can do a hearing test, but how many can actually do a speech and noise test in 2 minutes? And unlike other hearing clinics, we don't only measure, how soft you can hear, because that's not the client's problem. Their problem is how difficult it is to hear in noise. And now you can offer that to your client and do exactly that. So this really sets you apart from other competitors and sets a really brand new standard in your clinic. And in your client's eyes, you know what you're doing. You have a test to show for it. So in that sense, you offer a great solution, and that inspires trust and confidence. Okay, so let's put it all in practice and use a case study to see how ACT can actually make a difference in your clinic. So in this example, I have two clients. Their names are Frank and Estelle. So Frank and Estelle have the same age. Both of them are 70 years old. Same audiogram. It's a 40 dB flat hearing loss and fitted with the same hearing aid. That's a Bernaphone Encanta 400. Frank, he speaks Japanese, okay? And Estelle speaks Russian. But remember, it doesn't matter because the ACT test is not language specific. So the only difference here is actually the ACT value. Frank has an ACT value of 14 dB NCL. Estelle has an ACT value of 4 dB NCL. And I actually put a sad face here on Frank's ACT value because this means he actually has a severe problem with understanding speech and noise. So in the ACT value guide, -4 to 4 means, again, client has normal speech and noise ability and will most likely perform well with hearing aids. And as the ACT value goes higher and higher, you can see here that 10 to 16 is the most severe. So that's why Oasis Next will adjust the noise setting to the maximum highest level possible. So for Estelle, who is in the normal range, she can still use a more basic hearing aid. And for Frank, you will need to counsel and tell him that he will most probably have more difficulty in noisy situations, even with hearing aids. This is really important in setting expectations because if you tell them the hearing aids will solve everything, that is a sure way to lower client satisfaction. So set expectations properly. So in this case, a better technology level for sure with more noise management features will definitely help. A remote microphone or assistive listening device will also benefit Frank greatly to improve the signal to noise ratio. And Frank will also benefit from different kind of communication strategies or listening strategies, such as, for example, choosing a cozy, quiet place with carpet, low ceiling, tablecloth to dampen the noise. Or you can also tell Frank, hey, why don't you call the restaurant in advance so you can ask them for a quiet table in the corner? And you can also tell Frank, try to position yourself so you can clearly see the facial expression of the person that you're talking to. And all of these combined are good strategies to adopt so someone like Frank can get the best listening experience. And of course, not expect a hearing aid to make miracles because even people with normal hearing might also struggle with hearing and noise. So Estelle's ACT value is 4 dB, and it's really good considering her age. So Oasis Next reads this ACT value and automatically adjusts all of the noise parameters under program specific. And you'll see that they were adjusted because of the red and the blue icons. So ACT has prescribed these settings for Estelle. For smart directionality states, it's medium, which has around 80% effect. Smart noise reduction is also medium, up to 8 dB smart noise reduction. Transition is high. Speech balancer is medium, up to 3 dB enhancement of speech and noise contrast. Noise balancer is medium, up to 2 dB reduction of just noise only situations. Transient noise reduction is medium. So that's up to 15 dB transient noise reduction. So since Estelle can separate sounds and hear speech and noise well enough based on this really good ACT score, the software knows this and sets most of these features as medium. And you might be asking, why not just choose the highest setting for all of the clients? Then they can hear speech very, very, very clear, no matter what. The natural speech cues processed by the hearing aid should actually sound as natural as possible. And if we choose the highest setting for all clients, we actually lose the natural sound when we artificially try to optimize the settings too much, especially when the client doesn't need it. So since Estelle has a good ACT score, she will only need additional help from the hearing aid's advanced features when the situation actually gets more challenging. Now for Frank, his ACT value is 14 dB NCL, which means he has very severe difficulty understanding speech and noise. And this means that Frank will obviously benefit greatly from having additional technology to hear better in noise. And this could be recommending a higher hearing aid technology level, using a remote microphone, or something as simple as counseling the client to mute the microphone while they're watching TV or while they're watching YouTube on their smartphone. This could really make the difference because it enhances, again, signal to noise ratio. So Oasis Next takes this ACT value into account and automatically prescribes all these noise settings for Frank. You can see here that the smart directionality state, the smart noise reduction, and the speech balancer are now high compared to the medium before to emphasize and give more help for speech understanding in noise. The rest are the same. So since ACT is tested above threshold or above the hearing loss of the client, there are, of course, instances where the HCP should consider whether the test is actually appropriate for the client. So getting a really accurate ACT value can actually be more difficult if your client has a severe to profound hearing loss, if they have hyperacusis or severe tinnitus, since obviously presenting a loud stimulus might actually exacerbate the problem. We also don't recommend it if your client has less cognitive capacity to focus during the test. And also for clients who are under the age of 18, we don't recommend this test because we have not really carried out tests for the pediatric population as for now. So we don't have any norms to compare it to. Now that we know the possibilities with this test, how do you get it? So in order to perform the ACT test, you will need to have the relevant licensed software and also the diagnostic equipment. So you will need one of the following products. You already know I mentioned earlier regarding Interacoustics Affinity Compact with the software version of 2.21 onwards, and that is the one shown in this picture with the two people. It is also available for MedRx. It is available in Avant Arc, and this is this picture that I put here. And it also is included in these other equipments, Avant A2D Plus, AWRC, or Avant Stealth. And finally, it is available for GSI, Audio Star Pro. So ACT is available in these equipments. And aside from these, of course, you also would need a PC, your own personal computer and keyboard, headphones or insert earphones, no matter what you use in the clinic, and a patient response button. And don't forget, you need a license AC440 audiometry module, including which is included, the ACT license is included. And if you have further questions regarding this, please ask your regional sales director because, different markets have different availabilities. So it would be good to reach out to them if you have any more questions regarding this. And of course, ACT is compatible with Bernafon Encanta and Bernafon Alpha XT hearing aids with this firmware. So make sure you update it to the latest one. And for all the other hearing aids, ACT will not influence or adjust the settings in Oasis Nix. So there's no influence. It only works for these two. So why do clinicians like ACT? Well, clinicians like ACT because it just works. It's practical, it's easy, and it's effective. It's an objective test with years and years of research behind it. And then here it takes an average of 2 minutes to do. There are no language challenges, which means this test can be done worldwide in all countries. It is easy to learn and it's easy to perform like PTA. And it's a perfect partner to Pure Tone Audiometry because it tells you the client's actual real world hearing abilities and not just in a soundproof room. And although I know this test is probably not widely available for now, my hope is that this test can be used eventually all over the world in the next coming years once this test is available in more and more diagnostic equipments. And I really hope that ACT will be also considered a gold standard, same as pure tone audiometry, same as tympanometry, same as acoustic reflex threshold. And yeah, I hope that they will also use it for research in clinics, hospitals, universities. So right now, it's the start. It was launched just barely a year ago. So it's really, really young. But I think this is a really important test looking forward. So even if you don't have it now, hopefully in the future, if it becomes more widely commercially available, I really urge you to consider trying this test. Yeah, so that actually ends the presentation. We now have the Q&A. Okay, I have an attendee. Yes, thank you. So I can see that no one has really written a question, and that's normal. It's early for some people, it's late for some people, which is why I have prepared the questions for you. So some of the questions that you can see here, first, which might be interesting for you, is whether ACT can be performed on the pediatric population. So ACT studies have not been carried out with a pediatric population as of yet because the normative data is based on adults only. So when we did this with thousands of people, hundreds of people to get the normative test, it was only done in adults. So we only recommend that you do it for adults over age of 18, but hopefully in the future, especially for pediatric patients who can actually focus and do the test, then we would have the normative data. So we know what is considered normal, mild, severe for the pediatric population in the future. How loud is the ACT test? So the ACT test is automatically adjusted based on the PTA results. So that means that you always do the ACT test after the PTA. So this means that the ACT stimulus is clearly audible for all patients. So if the person has normal hearing, then the ACT stimulus would be around 63 decibel SPL plus minus, which is roughly the convert my voice right now. So that's conversational level. And of course, if the client has a hearing loss, then it is around, I don't know, 10 to 15 dB SPL higher. So that's the average estimate. Does performing act mean I do not need to perform a traditional speech and noise test? So the ACT test is actually a very good tool to predict your client's aided speech and noise ability and can be used to prescribe hearing aid help in noise settings before trying the hearing aids. So in this sense, you use this before you actually do anything with hearing aids, and it's done to help you with counseling and to set proper expectations. And most importantly, this ACT score can automatically change all the noise management features in Oasis Next. So how many speech and noise tests can actually do that? That's very special. With a traditional speech and noise test, you need to fit the hearing aids first and do the unaided and aided tests in order to assess your client's performance in noisy environments. So you can still do the speech and noise test that you already know. It's more for validation, of course, and the patient also needs to be prescribed and fitted with a hearing aid in order to do these tests. So, in that sense, it depends on what you actually want to do and what you're aiming for, because both are still useful. And of course, here are the resources that I will send to you after this webinar. You will receive the ACT Quick Guide on the left side of the screen showing you how it works in Oasis Next. And of course, don't forget that there's also a lot of information, as always, in the help files in Oasis Next. I will also send you the link to this 5-minute ACT video explaining what ACT is, what it's about, and again, this really well-rounded overview of this test. And I will also send you the scientific article on ACT. Don't worry, it's just 2 pages. Just so you know how they developed this test from scratch. And if you want the certificate for today's webinar, you need to do the fun quiz that I said. It's fun. It's not just a quiz, it's a fun quiz. So get at least 60% correct. And then after that, send an email to burnexportnews@demand.com with your complete name that you want to be written on the certificate. Okay? And these are the dates for the next few webinars. You will receive more information about these webinars in the newsletter that I will send out later this month. So that's the one that is on the right that I sent out for May. So please send an email again to the same address, burnexportnews@demand.com, if you haven't subscribed yet to our training communication and you want to receive these newsletters and invitations in the future. All right, now get ready with your phone to scan the quiz. You will see the QR code on this slide. So I'm very happy to see that so many people actually joined and did last webinar's quiz. Today's quiz is actually shorter and it's fun, don't forget. But most importantly, it's really a good way to review what we just learned today. So yeah, just scan in order to get the chance to win this beautiful pair of Encantas, of course, with a charger, because they're only available in the Mini Right R style. And yeah, so I will leave the slide on for the next few minutes. And with that, this is the official end of today's presentation. So as always, I thank you for taking the time out of your busy schedule. It's been a pleasure. And I am looking forward to see you next month for the webinar series we have on connectivity. So watch out for that and don't forget to register once you receive the invitation. All right, everyone. I now say goodbye. Have a good day.